St. Elizabeth Hospital started as a small dispensary in 1974. The founder was a Father Babu, who was the parish priest of Ngarenaro Parish by then, and in 1985, it was upgraded to being a full medical hospital. In 2011, it was again upgraded and was designated as Municipal Hospital, that is a City Designated Hospital, CDH. And from then, the church has been working together with the government in providing various medical service.
St. Elizabeth Hospital was built from the beginning by Reverend Father Joseph Babu, with whom I worked as a doctor, until we started with a dispensary and we came to a hospital. But this was possible through help from people from within the country and outside the country, especially Germany. And we are very grateful for those friends in Germany who made it possible to have this hospital come to the standard it is now. And many friends like Actor Medio, Miserio, many doctors in Ibbenburen like Dr. Meyer, Dr. Boehmer, Dr. Kuhnhardt, Professor Widmeyer, and many, many others, and especially Maria Bayer, who came to us many times, and after her visit in our place, she went home to organize for more help. Over and over again, she's still working to help us. And we thank you very much, Maria. We thank you all, dear friends, in Germany and all over in Europe, and we are praying that you continue helping us so that St. Elizabeth may continue being a standard hospital.
The hospital offers a variety of service to citizens of Arusha and beyond. This includes nearby regions and districts like Kilimanjaro, Manyara and Karatu, Monduli, Longido, respectively.
The hospital provides reliable services with relatively good customer care. The hospital serves patients from Arusha municipality and as well as from the vicinity of the city and the surrounding region. Our services are offered at relatively reasonable cost to low income and middle income patients. At times, the services are offered for free to expecting mothers and to the victims of motorbike accidents, which are plenty here. But these are the proven cases of inability to pay. We are aspiring to provide good quality services with good customer care and cost effectiveness.
Niseme tunazo huduma mbalimbali ambazo tunatoa kwenye hospitali yetu. Kwa mfano, kuna huduma za wagonjwa wa nje ambao tunaita outpatient departments, patient OPD, lakini tuna huduma za wagonjwa wa ndani kwa maana ya wagonjwa ambao wanalazwa IPD, inpatient department. Lakini nikianza na wagonjwa wa nje, ni wale wagonjwa ambao huwa wanakuja na kutibiwa na kurudi nyumbani. Wagonjwa hao wanaona madaktari wa aina mbili. Kuna wale wanaokuja kwa ajili ya kuonana na madaktari bingwa, lakini kuna wale ambao wanakuja na kuonana na madaktari wa kawaida ambao sio madaktari bingwa. Na kwa huduma za madaktari bingwa, tuna daktari bingwa wa magonjwa ya kina mama, gynecologist, lakini tuna daktari wa magonjwa mchanganyiko ambaye ni physician. Huyu anaona wale wagonjwa wenye magonjwa mchanganyiko. Lakini tuna daktari bingwa wa magonjwa ya macho, ophthalmologist, na tuna daktari bingwa wa magonjwa ya watoto, pediatrician. Hawa wanapatikana kila siku kwenye hospitali yetu.
Our hospital has 8 departments, and each department we have nurses and doctors who are in charge. As a matron, I'm in charge of in-services with the patients. All patients who are in the wards, challenges which face patients in the wards, and nurses, including the doctors, those who are dealing with inpatients. we managed last year to roof medical ward. We managed also to have a outside pharmacy, St. Martin de Porres, which was funded by Inca Krilling Poison's family, including the roofing of our hospital medical ward department. We have also tried our best to have doctors, specialists who come to see our patients. We have a physician, we have a gynecologist, we have ophthalmologist, and we have also visiting doctors who come to see our patients over the weekend. We have the orthopedic surgeon coming all the way from KSMC Hospital. We have the ENT doctor. We have we have also urologists who come to see our patients who have challenges in urological department.
This hospital also serves patients with National Health Insurance Fund coverage, NCCF insurance, and also Assembly insurance. St. Elizabeth Hospital has a laboratory that handles almost all tests. Approximately 95% of the tests can be provided in our hospital: X-ray, ultrasound, echo, and ECG.
Tunapima figo, tunapima utendaji wa ini, tunapima electrolytes ambazo zinapatikana kwenye mwili wa binadamu. Pia tuna vipimo kwa ajili ya hormone upande wa kina baba, wa kina mama. Hivyo pia tunafanya pamoja na kwenye department ya hematology tunapima damu, full blood picture tunafanya pamoja na parasitology tunapima kuangalia choo, mkojo pamoja na vipimo vingine kujua kwa kutumia darubini kuna shida gani.
At St. Elizabeth, we have pregnant women visiting for regular checkup, RCH, together with vaccination for children. We offer our service Monday through Friday. We also provide service to TB and HIV infected patients. They can also collect their medications anytime. For other patients, the hospital offers service every day of the week. The hospital also have inpatient service, whereby we have wards for women, mostly admitting expecting mother or those with other complications. There are also mixed ward for both men and women, especially for those mixed diseases. We have a pediatric ward and also surgical ward. The hospital provides private accommodation service.
Tuna wodi ya watoto ambayo ni pediatric ward. Tuna wodi ya kina mama kwa ajili ya kujifungua ambayo ni maternity ward. Lakini kwenye maternity ward pia tuna postnatal ward ambako baada ya kujifungua au baada ya operation wanakuwa wamelazwa mpaka wanavyoendelea vizuri wanaruhusiwa kurudi nyumbani. Wodi nyingine tuna wodi ya upasuaji kwa wanaume na wanawake. Tuna wodi ya magonjwa mchanganyiko, tunaita medical ward, ambapo pia kuna sehemu ya wanaume na sehemu ya wanawake. Na pia tuna vyumba maalum kwa ajili ya wale ambao wanahitaji vile vyumba ambavyo tunaita ni private. Vyumba hivi vipo kwa ajili ya mtu mmoja, lakini kwa ajili ya pia watu wawili.
The hospital faces the following biggest challenges in its day-to-day operations. One of the challenge, the buildings are old. The infrastructure of the building is a challenge.
The biggest challenge is space limitation. The space which we have is inadequate, and we have involved experts in prioritizing and coming up with the realistic space requirements, which came up to about 10,000 square meters. Now this is big, and it's not achievable in the short term. So we decided to phase it and set most competing priorities, reviewed the findings, and reduced the space requirements from 10,000 square meters to around 6,000 square meters, meaning that if we get to this space, we will achieve our aspirations of providing high quality services with good customer care and cost effectiveness, which is also the expectations of the patients who visits our hospital for services.
We don't have emergency department. We don't have enough doctors' rooms. The building is old. It's a long time ago. That's why we are looking for ways to fund and get a new OPD department where it will accommodate almost all our needs as a outpatient department. We have also challenges in our theater. Our theater is too small. In a month, we have almost 240 mothers who are admitted in our hospital who come for delivery, and almost 90 of them go for cesarean section. We have a small theater department. We have only one major theater and one minor theater, forcing the doctors to wait for each other in case of emergencies. We have a surgeon who is visiting surgeon. When we have surgical cases, they have to wait in case there is an emergency operation from a woman who has been divided to deliver.
Jambo la kwanza kabisa ambalo tungetamani tuanze nalo ni kujenga jengo linalohusiana na wagonjwa wa nje, yani OPD, outpatient department, ambayo hii itakuwa na room zote za madaktari, itakuwa na kile kitengo cha magonjwa ya dharura tunaita EMD, lakini pia ndani yake tutakuwa na vyumba vya kutosha vya madaktari kuwaona wagonjwa kwa wakati, na tutakuwa na maabara iwe ya kisasa kabisa ndani ya jengo hilo, na tuweze kuwa na hizi mashine za kufanya vipimo. Kwa mfano kama CT scan, MRI na mammography ambazo hatuna kwenye hospitali yetu kwa sasa, lakini na kitengo cha kuangalia wale wagonjwa ambao wanahitaji uangalizi maalum wa ICU.
We cannot do operation for neonates, operation for under 5 children because our anesthetic machine is too old. It's the old modern. We don't have the current automatic machine, forcing us to refer our children in case they need an operation to Mount Meru Regional Hospital. We don't also have enough, our anesthesia sterilizing machine is too small. It cannot at current accommodate to sterilize all the equipments for our hospital.
The current incinerator area is small. A modern system to ensure that all hospital waste is destroyed in accordance to the acceptable standards and highly needed.
Hospitali yetu haina mortuary, na mortuary ni eneo ambalo kweli nia ya hospitali ni kuwasaidia wagonjwa wote wapone warudi nyumbani, lakini kwa sababu moja au nyingine ambazo ziko nje ya uwezo wa hospitali, kuna wagonjwa wanakuwa wamefariki. Hawa wanahitaji kutunzwa kwenye eneo la mortuary ambalo kwenye hospitali yetu hatuna. Wakitokea watu hawa huwa tunawapeleka Mount Meru, lakini tungetamani kutoa huduma hizi pia katika hospitali yetu ya St.ELIZABETH.
Another important area in the hospital is the ICU. There is no designated area for ICU patients. Also, there is no mortuary. These are the areas that the hospital has a shortage in. We wish if the hospital is furnished with buildings in the area has been mentioned, the hospital will provide better service to the community, to Arusha residents and from other communities.
In our private ward, we need to have a lift, a ramp which can assist patients to move smoothly to private department, to medical department, to pediatric ward. But for now, they have to follow the stairs. Sometimes when they are critically ill, we have to carry them on the stretchers, we have to carry them on wheelchairs, which is so cumbersome for nurses, for the relatives, and for the patient. So we are appealing for our donors in case we get them, we really need a lift or a ramp to connect all our story buildings, and it will make the work easy. We also don't have emergency department. For current, we are just receiving them as improvised beds, improvised rooms. In case we get a current outpatient department, we really need to have our emergency department to be well equipped with equipments. We also don't have neonatal intensive care unit. Our hospital deliver women almost 250. Us having no premature unit makes our maternity department so difficult in case we get these children who are premature. We have to transfer them to LMC or we have to transfer them to Mount Meru. The challenges of moving them from one station to another and challenges of carrying them from disturbing them when they are so premature. Sometimes these children lose life, and so painful for the mother, so painful for the nurses, so painful for the hospital.
Hospitali yetu haina kitengo cha wale wagonjwa mahututi. Kwa maana maneno mengine tunasema ICU, Intensive Care Unit. Hili ni eneo wale wagonjwa ambao wamezidiwa na wanahitaji uangalizi maalum, wanahitaji kuwepo, kwa maana kwamba watakuwa wanaangaliwa kwa karibu na kunakuwa na vifaa ambavyo vinatumika kufanya uangalizi kwa wagonjwa hawa. Lakini na eneo pia. Kwa hiyo hospitali kama hospitali ya St.ELIZABETH tunahitaji kuwa na idara hii ya wagonjwa mahututi ikiwa na vifaa vyote vinavyohudumia wagonjwa hawa ambao wanakuwa kwenye hali ya dharura.
Basically, people have faith in our hospital. However, the challenge that presents itself that discourage people is when they come to the hospital and find that the hospital is unable to provide service as expected because of all the challenge have been mentioned.
Mtoto wangu nilimleta akiwa na hali mbaya sana. Ila yani nilipofika hapa wakanipokea yani haraka haraka, mtoto akaitibiwa haraka haraka. Kwa kweli sasa hivi mtoto wangu anaendelea vizuri, namshukuru Mungu.
Madaktari wako usiku, wanahudumia usiku, mchana, yote sio mbaya. Sisi tulifurahi.
Kiukweli huduma hapa ni nzuri. Kwa sababu nilikotoka na nikafikia hapa, nilipokelewa vizuri. Tofauti na huko nilikokuwa, na nikapata huduma nzuri kwa wakati mpaka hapa nilipofikia.
Und das ist alles möglich geworden durch Hilfe von großen Freunden aus Deutschland, aus Ibbenbüren, aus Aachen, aus Münster, überall in Deutschland, wo ich war. Und diese Freunde, ich möchte jetzt ganz nah meine Dank aussagen. Im Auftrag von St.ELIZABETH Hospital sage ich ganz herzlichen Dank für die enorme Hilfe. St.ELIZABETH ist aufgebaut von null bis auf die erste Standard. Durch Hilfe von Miserio, Aktion Medio, viele Ärzte in Ibbenbüren, Dr. Meyer, Dr. Bäumer, Dr. Kühnhardt, Professor Widmeier und so viele andere Leute. Und auch ganz besonders Frau Maria Bayer, die immer zu uns gekommen ist. Und nach Visite bei uns hat sie immer weiterhin Hilfe gesucht für St.ELIZABETH Hospital. Ich sage im Auftrag von St.ELIZABETH Hospital ganz vielen Dank und bitte machen Sie weiter. St.ELIZABETH muss weiter wachsen. Vielen Dank.
We believe that this is doable, and with the support and the collaboration of stakeholders who shares this our aspirations or this vision of providing high quality services with good customer care at reasonable cost or affordable cost to low income and middle income patients will be achieved. And not only that, but that as well will enable us to attract and retain best health experts.
We get so minimal small support from the government. We run under 5 department free. We run maternity department partially free, making sometimes our services to meet the cost effectiveness of the hospital is so difficult. We also admire that one day our hospital could be raised to level 5, level 4, so that we can be able to run our hospital. And many a times we really admire as a church, as a hospital, our staff to be well equipped so that they can be able to deliver good holistic services to our patients.
The hospital has been operating on behalf of the church to ensure that even those who cannot afford or receive medical assistance, we are fortunate we keep receiving patients from within and outside Arusha. Thank you very much for watching and listening.